Hello everyone. Throughout my 4 years as a certified nurse's assistant, I found a passion that I was unaware I would encounter, being an advocate for the elderly. An advocate is defined as a person who publicly supports or recommends a particular cause or policy. As a newly licensed nurse and a former CNA, it is my responsibility to be a vocal advocate for those who are vulnerable and need further assistance in their day-to-day life. I am here today to talk to the families and the caregivers of this growing population to raise awareness about the mistreatment of our elders. This is a cause that is near and dear to my heart due to the patients I have met and the elders in my life as well. I worked at a nursing home for 3 years, which first started my love for caregiving. As an aide, you become close with a lot of your residents because you see them every day. You learn their routine, what they like and dislike, and you also get to know their families. It's almost as if you've gained new grandmas and grandpas. While there are good patients, there are also patients that are difficult to work with, whether it's caused by dementia, depression, or overall unhappiness. As a caregiver, it is our job to stand up for the elders in our life because most cannot do so themselves. Being an advocate means we speak out for those that cannot speak on their own behalf. This means we must be present in decision making and follow the elders' wishes, not our own. As an aide or nurse, it is our responsibility to speak up for patients, which can sometimes go against the family's wishes. An example would be if a patient repeatedly refuses food and water, which they often do at the end of their life, and the family is adamant on encouraging fluids, you must stick up for the patient and speak with the family. At hospitals, there are resources such as social workers and palliative care counselors that can help educate the patient's family. But regardless of this situation, we must be the ones advocating for our patients' needs and wants. Families have a tough time at the end of life stage, which can bring up anger and hate towards the medical staff and sometimes the elder. Trust me, I know how difficult it is to have 14 patients who all need a bath within the 8 hours you are working. It is easier to say that the resident refused a bath instead of taking the time out of your day to complete this task. It is in our human nature to choose the easier route, but this is why we need to become the elder's advocate and speak up for the well-being and the care they are receiving. If your grandma and grandpa was in a nursing home and you found out they hadn't gotten a bath in 2 weeks, you would be mortified. This is the type of mentality we need to have when caring for this population. Even if the task at hand is trying for you, it means the world to the elder. One cause for concern in our elderly community is nutrition or lack thereof. As caregivers, it is our mission to make sure they are properly fed and meals are accessible. Malnutrition is a common problem in the elderly population because of lack of appetite and disease, but also because of the access to resources. They have a tough time preparing meals and shopping for groceries. There are associations that provide meals to seniors, such as Meals on Wheels. They have a program that brings 1 to 3 meals to seniors daily, right to their door. This gives them a chance to prepare meals daily with little effort. One of the main reasons for elders being hospitalized is pressure ulcers. Pressure ulcers are sores developed by prolonged friction and pressure on bony parts of the body, such as heels and elbows. The elderly are at high risk for developing pressure ulcers in the hospital, at the nursing home, and even in their own home. Their low nutrition, aging skin, a high risk for infections, and decrease of mobility are all risk factors for pressure ulcers. Once an ulcer occurs, the elderly is at risk for an infection. The process of preventing a bed sore is much easier than treating one. That's why we must be constantly watching for signs and symptoms. As a caregiver, taking precautions to prevent a pressure ulcer is crucial. Immobile elders must be turned in bed every 2 hours to prevent the occurrence of a bed sore. Pillows are used to rotate between left side, right side, and back. If a person spends most of their time in the wheelchair or a chair, they must also shift their weight every 2 hours. Pillows can be used to support in this case. As an aide or nurse, it is crucial to educate the family on the importance of position changes, mattress choices, and adequate calorie intake to ensure the patient is being taken care of all the way around. If you notice a coworker or family member is having a tough time sticking to the 2-hour rule, it is best to speak out and be a voice for your patient. I understand that making it in to see a patient every 2 hours is hard when you are taking care of so many others, but that is part of being an advocate. The immobile patient is unable to handle this task alone, which means it must be our responsibility to make sure it gets done, regardless if you have time or not. Prevention and treatment of a bed sore are handled differently. In both cases, a foam barrier can be used called a Mepilex. A Mepilex is placed on a patient who is at risk for a bed sore, such as someone who is going through a long surgery or someone who is immobile for a long time. The barrier is placed as a precaution and to stop the growing of an existing bed sore. There are different size barriers for different parts of the body. This is a sacrum Mepilex and it's placed on the tailbone. It is placed on the tailbone to ensure the patient isn't allowing too much pressure or friction on that area. One of the responsibilities as an advocate is to make sure the elders in your life are getting the care that they want, not the care that you think that they want. When it is our own family member, it is sometimes hard to be biased. We often want the elders in our life to choose the decisions we want when it comes to end-of-life care and advance directives. Part of being a successful advocate is respecting the wishes of the elders in our lives. Having an open and honest conversation about end-of-life care will help establish boundaries and let you know how they want to pass. An advance directive is a good way to set baseline instructions for their care. You can customize the documents to cater to the elder's needs and wants. This is helpful in a dire situation such as respiratory distress or coding. Families often get emotional and do not want to see their loved ones die, but with advanced directives, the elder can pass without having any intubation or life support. As an advocate, we must take the time to understand the elder's needs and put our emotions aside to ensure they are getting the care that they want. There are many qualities that make up a good elderly advocate, but the most important ones are trust, honesty, and a caring touch. Whether it's the small gestures such as brushing their hair or something life-changing such as the end-of-life care, the elders in our population deserve loving caregivers that are willing to put their needs above our own. Although it's hard work, I am urging everyone to be an elderly advocate, whether it is in your workplace or in your own home. Thank you.